Hello, and thank you for joining me today. If you or someone you love is expecting, this is an important message to listen to. Did you know that vaginal bleeding during early pregnancy occurs in about 20 to 30% of pregnant women? That's nearly 1 in 4. So if it happens to you, know that you're not alone. Sometimes this bleeding might be just a small spot. Other times, it could be more noticeable. And interestingly, it often doesn't come with abdominal pain, which can make it even more confusing or unsettling for new mothers. The good news? In many cases, the cause is completely benign and temporary. But as a physician, I always remind my patients, context matters. Certain types of bleeding can be signs of more serious conditions, and understanding those signs can make all the difference for both the mother's health and the baby's development. So don't ignore it. Be observant, be informed, and be proactive. Common and typically harmless causes of bleeding. Implantation bleeding. This is one of the most common reasons for early pregnancy spotting. As the fertilized egg attaches to the lining of the uterus, some women may notice light spotting, often brown or pink in color, possibly mixed with a bit of mucus. It usually resolves within 1-2 days, is painless, and is not a cause for concern. Hormonal changes. Pregnancy causes a sudden surge in hormones, and in the early stages, the body may need time to adjust. These hormonal shifts can lead to brief episodes of spotting, which often disappear once hormone levels stabilize. Sexual intercourse. During pregnancy, the cervix becomes more sensitive due to increased blood flow. Sometimes vigorous or improperly positioned intercourse can cause irritation and result in light bleeding. It's important for couples to be mindful, especially during the first and last trimester, and to speak with a healthcare provider if unsure about what's safe. Genital infections. Hormonal changes during pregnancy can alter the vaginal pH balance, increasing the risk of yeast or bacterial infections. These infections may cause inflammation, irritation, and sometimes bleeding. If this occurs, it's essential to be evaluated by a physician. Early treatment protects both the mother's comfort and the health of the pregnancy. Dangerous or abnormal causes of bleeding. While many causes of early bleeding are benign, there are serious conditions that should never be ignored. Ectopic pregnancy. This occurs when a fertilized egg implants outside the uterus, most commonly in a fallopian tube. It's a medical emergency and requires immediate attention. Threatened miscarriage. Spotting may be an early warning sign. With prompt care, some pregnancies can still continue normally. Molar pregnancy, tai trung. This is a rare condition where abnormal tissue develops in place of a healthy embryo. It must be diagnosed and managed medically. Missed miscarriage. Sometimes the fetus may stop developing without immediately passing from the body. This condition can be emotionally difficult and requires medical evaluation and support. These serious causes often present additional symptoms like cramping, heavy bleeding, or dizziness, but not always. That's why any bleeding during pregnancy should be reported to your healthcare provider, even if it seems mild. Every pregnancy is unique, and your body deserves attention and care. If you ever feel uncertain or uncomfortable with what you're experiencing, trust your instincts and don't hesitate to reach out to a medical professional. What to do when bleeding occurs? The most important thing? Stay calm. Bleeding doesn't always mean something is wrong, but it is your body's way of asking you to pay attention. Here's what I recommend. Monitor the bleeding carefully. Is it light spotting or heavier flow? What's the color? Bright red, brown, or clot-filled? Is there mucus or tissue present? This information helps your healthcare provider make an informed assessment. Seek medical care promptly, even if the bleeding seems mild. Early evaluation can rule out serious causes and give you peace of mind. Avoid sexual activity while bleeding, as it may aggravate sensitive tissues or underlying conditions. Get plenty of rest and nourish your body with a healthy, balanced diet to support healing and reduce stress on your system. Preventive measures and ongoing care. Taking steps to protect your health before and during pregnancy is one of the best gifts you can give yourself and your baby. Here's how. Attend all scheduled prenatal visits and ultrasounds. These appointments aren't just routine, they help detect any early warning signs and ensure your baby is growing well. Don't skip your regular gynecologic exams. Conditions like cervical polyps, infections, or even early signs of cancer can often be managed more effectively when caught early. Maintain daily hygiene, especially in the genital area. Keeping the area clean helps prevent infections, which can become more common due to hormonal changes during pregnancy. Live a balanced, healthy lifestyle. Get adequate sleep, eat well, hydrate, and follow the advice of your medical team. Your body is working hard. Give it the support it needs. Bleeding during pregnancy can be unsettling, but knowledge, preparation, and timely care make all the difference. The more you listen to your body and act early, the better your outcomes will be. As a physician who has guided many families through pregnancy and health challenges, I want to close with a heartfelt reminder. Vaginal bleeding during early pregnancy is not uncommon, but it should never be ignored. In some cases, it's simply your body adjusting to the early stages of pregnancy. In others, it may be a warning sign of something more serious. That's why early detection and medical consultation are absolutely essential. Please, listen to your body. Notice any changes in bleeding, pain, or how you feel overall. If something doesn't seem right, don't wait. Reach out to your healthcare provider. It's always better to ask questions and get answers early rather than too late. Keep up with your prenatal appointments, follow a healthy routine, rest when your body tells you to, and nourish yourself well. These simple steps can go a long way in protecting both you and your growing baby. If this video has helped you or could help someone you know, I encourage you to like and share it. Together, we can spread knowledge, support, and comfort to many others navigating the journey of pregnancy. Take care of yourself. You and your baby deserve the very best.